Hi, my name is Dr. Kronk, and recently I was asked a question. I've been a licensed doctor of chiropractic for 31 years, and recently I was asked a question: what do you think is the biggest threat for the profession of chiropractic in the injury space, in the spinal injury space? And I said, oh wow, that's super easy. It's the same in the injury space as it is for the patient, the profession as a whole, and that is lack of alignment of procedures, lack of alignment. So the whole profession, I've been a licensed doctor of chiropractic for 31 years. The whole philosophy of chiropractic is alignment improves function. Alignment of the spine improves the function of the spine. Alignment improves function. Yet I am involved with a profession that is probably the most misaligned of any profession. If you looked and you said chiropractic, physical therapy, medicine, medical specialties, osteopathy, if you looked at radiology, if you looked at these professions, they're very aligned. If you looked at the list I just listed and said, what's the most misaligned profession? It's the profession of chiropractic. It's our profession, my profession. Now in the area of injury space, it's kind of easy to understand it because there is no formalized education on injuries in any chiropractic school in the country. Now, not to make that problematic, because there aren't in medical schools, there aren't in osteopathy schools, there aren't in doctor of PT schools either. Yet the spinal condition itself, lumbar spine, is the number one cause of pain and disability in the world today. Neck is number 4, headaches is number 6. These are the leading causes of chronic pain and disability, right? And there's no formalized education on the thing that causes that, which is an injury. There's no formalized education anywhere. So it's easy to see why it would be misaligned. But chiropractic has had, for the longest time, it's had the advantage. 30, 40 years in the market, it's had the advantage on spinal injuries. But it hasn't utilized that to align, right? Why is it that if a patient goes into a chiropractor's office, when I was doing a conference one time in Michigan for one of the largest defense firms, I was speaking in front of doctors, in front of case managers, IME providers, special investigation unit people for the largest insurance carriers in the country. And when I was saying, look, the biggest problem in the market is lack of alignment of procedures. And I said, look, if you go into a hospital, you're going to get a different workup than if you go into a outpatient medical facility. And then if you go to a physical therapist's office, you're going to get even different diagnosis, different workup. And then I said, what about the chiropractors? And the laughter that came out, right? It's all different. How in the world do you interpret what one's an upper cervical provider, one's a CBP provider, one's a straight diversified provider, somebody's trying to correct the spine, now those are all treatments, right? And I get that, but the diagnostic workup of the injury doesn't matter what kind of treatment you do. That's treatment side. That's going to be different, and that's different in a lot of professions. But the workup side, that should be all the same. There's not a person in the country that has a spinal injury that shouldn't walk into a doctor that knows how to work up. There's only 3 main injuries that any spine can have. And you need to understand how to work them up. And when you understand the consensus around them, especially consensus around the ligament injury and what does it mean, it's off the charts. The guidelines are right there. The majority of doctors just don't know them, so they don't align with them. And when you're not aligned as a group, you will lose function. And losing function in the case of a profession means losing market space, right? There's a lot of market pressure right now. You got physical therapists coming into the market, and I don't care. I want any doctor to hear this. I don't care who becomes the best at spinal injuries. All I've ever done is said, look, you have to diagnose these, work them up. There's far more than a disc injury. Just nothing drives me crazier than to see a doctor's office that goes MRI, MRI, MRI. Why do you MRI? Because the attorneys want me to MRI. That's not a clinical rationale for doing an MRI. Now, if you want to know if there's a disc injury, you're going to do an MRI, right? But if the disc is injured, oftentimes the support ligaments are damaged. And if you're not doing a support ligament assessment, you're not doing a full spinal assessment. And the disc and the MRI is a very limited spinal injury imaging procedure. It's a great imaging procedure, but it's limited. So doctors should know that, right? And because our profession doesn't know it, you have the profession of physical therapy right knocking at the door. And they are at the point of getting full imaging, where they can send out for imaging, get the interpretation, diagnose the condition. They're right there in almost all states now, right? So you have large market pressure that's coming in. If you're going to lead, you got to lead. And there's no way a patient should go into any doctor of I don't care what your technique is. The spinal injuries are the same. It doesn't matter whose office they walk into or what technique that office does. The injury is the same. Kind of think of it this way. If I burn somebody, right? I burn and practically singe their arm off. I walk into a chiropractor's office, that burn is the same. How you approach it might be different, that burn is the same. If I walk into a medical doctor's, burn is the same. Osteopath, burn is the same. Doctor of PT, burn is the same. Spinal injuries are the same no matter whose office or what your technique is or what your ideas of these injuries are. The injury itself is the same. And we have to have a unified alignment with procedures. Nobody should go into any chiropractor's office and not get the same workup. Do you go into a dental office with a sore tooth and everybody looks at it a little bit different way? In the dental world? No, you don't. They actually come in, they exam, they pick, they x-ray, they repick, they tell you what they have, they tell you what the diagnosis is, and then they tell you what the treatment is. It's the same. Little different technique, little different procedures, but it's the same. Now that profession has grown tremendously. So anything that's aligned, an alignment of procedures, is the best way that I know to become really, really powerful and functional in the market today. So if you're a doctor of chiropractic out there that wants to expand more into the injury market, you have to understand that there are 3 main injuries to the spine. And you need to know all 3 of them cold. And you need to know what the consensus are around them, and what the guidelines say about them. Because as soon as you do, you will feel better. You'll feel better with what you're doing. Hey, I'm not looking over my shoulder. Am I doing something not right? Did the last guy who taught me teach me right? I went from a PI clinic and I didn't like some of the ways they did it, so now I'm doing it this way, but the attorneys are telling me that I should do this, and I'm being dictated care by attorneys. Nothing actually gets me more upset for patients when you have non-doctors dictating care. And they dictate care more out of a settlement than they do out of what is actually wrong with the patient and what does that patient need. Because at the end of the day, everything I do and everything you should be doing is what is best for the patient. If you lead and you always go in the direction of what is best for the patient, what can I do? Now, you can make large amounts of money. I think injury providers should be the best paid providers in the world, because the statistics I just said, number 1, number 4, number 6 leading cause of pain and disability. If you can knock that out, the lifetime savings to insurers, the lifetime savings to patients is phenomenal. So I have no problem with the environment exchanging well with you and saying, hey, you should be paid well. I think you should be paid well. But I also think that an injury patient should be very choosy about who they go to, especially when they have a spinal injury, because 55% of them are never going to fully recover. So that statistically is true. And the statistics are even worse than that. I look at it and say that is not a patient problem. That's a doctor problem. And the only way we resolve that problem is to better understanding the injuries and more alignment in our procedures. You have to know what the injury is first before you go. And if you don't know the 3 main injuries, then it's very difficult to actually work them up. So doctors, if you have any questions, we have a program that helps doctors do that all across the country. It's chiropractors, it's medical doctors, it's doctors of PT, that we help to align your procedures and your understanding the injuries themselves, and then help once you know and you're really good with spinal injuries, you should be a clinic that is treating the majority of these spinal injuries. If you're a spinal injury group that's already has a massive amount of injury work that you do, then you need to stay on the cutting edge of always continuing to improve yourself and improve your understanding so you can improve and expand your group so no one's taking your market share. Doctors, if you're a good injury provider, I think you should be super, super, super busy. And that's all I do, is try to help doctors who are good injury providers or who want to be better injury providers to do that. Hope something I said helps you. today. Again, you can put comments down below. We also have a private Facebook group where I share things like what I'm sharing with you today, more in that group. If you just put a comment down below, we'll get you a link, we'll get you in that group. I also have a Smart Injury Doctors podcast. If you go to Apple Podcasts and put in Smart Injury Doctors, you'll see the episodes. I think we have 101 episodes now, and it's all little 9 to 12 minute where I'm riffing on a subject just like I did today. And when you listen to them, you'll actually go, wow, some of this stuff is just really, really good, and it really helps me to understand what I'm doing better as an injury provider, or how I'm communicating to a person, or how I'm communicating to an insurer. So we have a lot of resources to help, and that's what we do, and I hope something I shared with you might help today. Thank you.